Upper blepharoplasty is a upper eyelid lift, okay? It is a very simple procedure where we remove the excessive skin that's in the upper eyelid, and on occasion, we reposition or remove some of those fat pads that are causing fullness over the eyelid as well. This is a fairly straightforward procedure that's done under local anesthesia, a lot of times with or without sedation, very well tolerated. The recovery time is really simple. Typically patients have no pain, I would say. It's very minimal discomfort. We typically don't even give pain medicine. They can take Tylenol and ibuprofen, and that usually takes care of it. They have stitches that sit kind of like on the eyelid crease. So when you open your eyes, the stitches are tucked in, and the stitches come out usually 5 to 6 days after the procedure. The scar heals beautifully. This is a very thin skin, tends to heal great. Most of the time, 3 to 6 months after the procedure, you can't even find a scar. It heals so well. Bruising and swelling, you can expect that maybe to a certain degree in the first week, but all in all, is a pretty simple recovery. There is a lot of reasons that people look for blepharoplasty. If they want to, sometimes they want their eyes to look more awake, a little bit more energetic. Sometimes they feel energetic, but then they kind of like look tired, and an upper blepharoplasty can help them with that. Some women complain that they have trouble using eye makeup, because the skin goes over, and that's a reason that they look for this kind of procedure. But it's a simple procedure that really brightens up the eye. On a subset of patients, sometimes the excess of his skin is such that it kind of like, it's almost like it rolls over the lashes, and it can actually, create a little problem on the visual field. So some people actually report that they can improve their vision after a blepharoplasty. Blepharoplasty is a super simple procedure, very low downtime, in recovery, and it really does give the patients a great result, and for something that's done in the office, I think I have a very low threshold to recommend, because it's just one of those simple, easy fixes that can really help people.